Alright, so today we'll talk about septic shock. Now, for we to understand septic shock, we need to know what sepsis means. So, because this septic shock is a subset of sepsis. So, what is sepsis? What do we mean by sepsis? To know what sepsis means, we need to know what septic shock means. Okay? Now, when we talk about sepsis, basically, the first thing you need to know is that it is a life-threatening condition. Life-threatening condition. Okay? Life-threatening condition, and this life-threatening condition is associated with multiple organ failure. So we have multiple organ failure, okay, and this is all due to the fact that we are having a dysregulated response to an infectious agent. So the first keyword in sepsis is that what it is life-threatening, is leading to what multiple organ failure, and this is usually due to a dysregulated response of the host to the invading pathogen. Now, when we not talk about septic shock, on the other hand, septic shock is a subset of sepsis and is more severe in the sense that the sepsis has now graduated or has now become more pronounced. So septic shock is a subset of sepsis that is characterized by profound derangement in both cellular. So we have both the profound derangement in cellular, circulatory, metabolic, and even you are also seeing a lot of multiple organ failure too. So there is a profound derangement in cellular function, in metabolic function, in circulatory function, and you are seeing wide multiple organ failure associated with hypotension. Okay, you are seeing hypotension, and this kind of hypotension you see in septic shock cannot be reversed by, it's not usually reversed by giving fluid, you get. Okay, so let's proceed. So from the definition here, you can see that septic shock is a shock that is due to severe sepsis. Okay, it's a shock that is due to severe sepsis with hypotension, which cannot be corrected by infusing of fluid. Okay, so septic shock also, it results from what when there is vasodilation. So as we proceed later, you get to understand that in septic shock there is what vasodilation and peripheral pulling of the blood, you get. So this vasodilation is usually caused by bacteria. Okay, so there's a due to the dysregulated response of the host immune system to the bacteria, we are seeing massive vasodilation. And once there's vasodilation, there will begin to be peripheral pulling of blood. That's what you will see. So there will be peripheral pulling of blood, and when you have this peripheral pulling of blood, what you get to notice is what edema. And once there's edema, both nutrient supply and removal of waste product from that particular organ will be hampered. So there will be what multiple organ failure. Okay, there will be multiple organ failure. All right, now what could be the cause of septic shock? Like what I described earlier, I said the usual cause of septic shock are bacteria, and the bacteria in question here is usually your gram positive organisms. So gram positive organisms are usually the culprit in septic shock, although we also see what gram negative, but majorly we are talking about gram positive organism, gram negative organism, and also sometimes fungi too could be involved, and sometimes rarely, very rarely, you can have protozoa, you can have your rickettsia organism also implicated in septic shock. Now, the most common gram positive organism that we get to see in septic shock are your Staphylococcus aureus, Enterococci, and Streptococci pneumoniae. These are all gram positive cocci. Okay, they are all gram positive cocci. Also, we also get to see some gram negative bacilli that are also involved in septic shock. Now, the hallmark of septic shock, basically, like I explained, is that due to the interaction of the bacteria and the host immune system, we get to see what peripheral vasodilation, and this peripheral vasodilation is then associated with pooling of blood, which will lead to edema. And once you're having edema, you will begin to see what? You will begin to see multiple organ, like there will be no enough nutrient getting to the cell, and again the waste product will not be able to be removed. Now, what could be the pathogenesis of this septic shock? Now, septic shock, basically, in terms of pathogenesis, you need to know that due to this, again, this response of the host immune system to the bacteria, there will be, I know this response is usually what? Inflammatory in nature. So you will have the inflammatory response and the counter-inflammatory response. So there is a common misconception that, oh, septic shock, we are always seeing inflammatory component. No, there's also the what? The counter-inflammatory component. Now, from this inflammatory component, we are going to see how it will accumulate to endothelial cell activation, how it will accumulate in favoring the procoagulant state, how it's going to accumulate in metabolic abnormalities, organ dysfunction, and even immune suppression, as we see shortly. So, as a rule of thumb, I can say that in septic shock, let's come to this place again. I can say that in septic shock, due to the response of the body to the bacteria, could either be an inflammatory response or a non-inflammatory response. Just to summarize, so if I'm saying that we're having the bacteria here, so this is our bacteria, is that also? Now, the way the body will respond, the response of the body to this bacteria could either be what? Could either be inflammatory or non-inflammatory, of which most of the time is usually inflammatory. We also have the non-inflammatory component. Okay, now when we talk about this inflammatory component, basically it means that due to the interaction with the bacteria has certain peptide that will interact with the host cells. So your macrophage, your neutrophils, those what we call pathogen associated molecular patterns. So your innate immune system will be able to react with the bacteria, and there will be release of cytokines like what? Your interleukin 1, interleukin 12, interleukin 16. So all those ones, all of them will be what? Will be released. And the effect of this is that they will favor inflammation. So they are pro-inflammatory cytokines. So if you come to this place now, you will see that there will be release of these factors: interleukin 1, interferon, then interleukin 12, interleukin 13. All these are all pro-inflammatory cytokines that are released during the process. And the effect of this whole cytokine is that they are going to affect the endothelial cell. So at the end of the day, all your cytokines that are produced in response to septic shock, they usually affect the endothelial cell. So that's one of the major area there, one of the major cell that is affected. So now, what could be the response of this endothelial cell? And the response of the endothelial cell most of the time could be that due to this cytokine, the endothelial cell could shrink in. It could shrink in, and when the endothelial cell begin to shrink, what you see is what? There will be extravasation of protein-rich fluid into the interstitium. So you will begin to see protein-rich fluid in the interstitium. Again, this will lead to what? This will lead to edema kind of formation. And once there's edema, most likely you are going to see multiple organ failure, because edema prevent both nutrient supply and waste removal. Now, again, this activated endothelial cell can also, let's see, the activated endothelial cell can also do what? They can also produce a nitric oxide. Let me see if I put it here. Yes, they can also produce nitric oxide. You can see it here. They can also produce what? Nitric oxide. They can also produce nitric oxide. And this nitric oxide that is being produced will cause your vessels that are further apart, like your smooth blood vessels, to dilate. So they will dilate, and when they dilate, they will begin to be what? More you begin to see systemic hypotension, again due to the what? Due to activation of the endothelial cell. Now, what I've given you two effects of activation of this endothelial cell, or effect of the cytokines on the endothelial cells. One was that there will be shrinking of the endothelial cell, so their tight junction will be lost, and when their tight junction is lost, there will be extravasation of fluid into the interstitium. The second effect is that what? This endothelial cell will begin to produce what we call nitric oxide, and this will lead to what? to hypotension, because the nearby blood vessel will begin to vasodilate and you're going to see systemic hypotension. Then again, the next effect is that still on this endothelial cell, the endothelial cell will become more coagulant, so they will begin to they will tend towards coagulation. They will tend towards coagulation. So that's what you see here, that they will begin to favor a procoagulant state. Very important. So a procoagulant state will be favored. A procoagulant state will be favored. Okay, and this procoagulant state will lead to the formation of thrombi. And thrombi, once thrombi is formed in those vessels, again, oxygen supply to the tissues will be reduced, and there will be tissue ischemia. Again, there will be organ failure also in that scenario. So that is the catch. Then what is now the effect of all this? What now the effect of all this? At the end of the day, apart from the organ dysfunction we see due to decreased oxygen supply and decreased nutrients, we are going to see also, I've also talked about this multiple organ failure. We're also going to notice that there will be some metabolic abnormalities. Now, the cytokines that are produced, all those inflammatory cytokines, your interleukin-1 and your tumor necrotic factor, these factors tends to cause some metabolic changes in the body. And the number one metabolic change you will notice is what we call insulin resistance. So there will be insulin resistance in the patient. Insulin resistance is usually alluded to the fact that your GLUT4 will not be transcribed or will not be expressed well by those tissues. So there will be down regulation of GLUT4 transporter. So that will lead to insulin resistance. Then again, certain hormones like your stress hormone are produced. Hormones like glucagon, hormones like your growth factor, hormones like glucocorticoid, they will be produced in excess. And once these hormones are produced due to the stimulation by the cytokines, again, there will be what? Glucagon will lead to hyperglycemia. So you will begin to see hyperglycemia in that patient as part of the metabolic derangement you will see. And hyperglycemia will decrease neutrophil function, and this will suppress the bactericidal activity and cause expression of more adhesion molecule in the endothelial cells. Then again, initially there was an increase in the production of glucocorticoid, but after a while the production of glucocorticoid will decrease, because initially there was an increase due to the stress, but later on due to the fact that you are not getting enough blood supply to that particular adrenal gland, again it is going to be decreased this is due to adrenal insufficiency, like I explained just now, due to the fact that not much blood is not going to the adrenal gland like that. Now this adrenal necrosis that could occur, or insufficiency that could occur, could be due to the fact that we are having multiple thrombosis, which we call the DIC, disseminated intravascular clotting. So due to this DIC, we are going to see a phenomenon that is called the Waterhouse-Friderichsen syndrome. So this is just a phenomenon whereby we are seeing the fact that we are noticing adrenal necrosis, and this adrenal necrosis is due to DIC, the fact that there are multiple clots. So it's not leading to deficient oxygen supply to the adrenal gland. Then again, another metabolic derangement you will see will be lactic acidosis. This you can easily explain to the fact that we're having cellular hypoxia and diminished oxidative phosphorylation. Then your red blood cell will begin to die and release lactic acid. And lastly, I think that is all for last thing we will not talk about is the fact that we said we also have the immunosuppressive part of septic shock. Now that immunosuppressive part at the end of the day will lead to this is a counter-regulatory immunosuppressive mechanism. So at the end of the day, it's more like we are going to see immunosuppression in the patient. We're going to see immunosuppression in such patient of septic shock. Now, what would be the factors that some patient could have pro-inflammatory, some patients will have anti-inflammatory? It depends on the patient, and it also depends on the severity of the body, let's say the bacterial load. So thus in a patient with septic shock, there may be oscillation between hyper-inflammatory condition and immunosuppressive state. This immunosuppressive state is usually a shift from pro-inflammatory HEPA cell, which is HEPA T1 cell, to HEPA T2 cell, which are anti-inflammatory. So and this will lead to production of a different anti-inflammatory mediators like your soluble tumor necrotic factor, interleukin 1 receptor antagonist, interleukin 10. So you should take note of this interleukin 10, because interleukin 10 is a what? It's an anti-inflammatory cytokines. Alright, so this is all for septic shock. In this video, I've been able to describe what septic shock means, what sepsis mean, and the fact that the septic shock is just a condition where it's a subset of sepsis that is characterized by what? By profound cellular, metabolic, and circular derangement. Okay, and you are seeing hypotension all over the place, and this hypotension cannot be reversed, or it's not usually reversed by giving fluid, because if you give fluid, the endothelial cells are already damaged, so you are going to worsen the edema in such case. And I said, what could be the causative organism? The causative organism again are your gram-positive organism, gram-negative organism, protozoa can also be implicated, fungi can also be implicated there, but those ones are usually in immunocompromised patients. For the pathogenesis of septic shock, I already explained that it could be inflammatory. It's just the response of the bacteria to the organism. We have inflammatory arm, we have the counter-inflammatory arm. By virtue of the inflammatory arm, certain cytokines are produced. These cytokines led to the activation of the endothelial cell, which have three main effects. It could lead to shrinking, leading to edema. It could lead to what we call production of nitric oxide, which will cause hypotension in nearby vessels. And also there will be even in systemic circulation, in the entire systemic circulation, there will be hypotension. Then also there could be procoagulant state formation, so the endothelial cell will most likely form coagulation. Okay, then the next thing we talk about again there was that we also have the anti-inflammatory component of this. Now take note that not only it's not only by activation of the immune cells that you have production of cytokines. Sometimes the bacterial product directly can also activate the endothelial cell. So you can see that the bacterial product directly can also activate the endothelial cell. Then also endotoxin from the bacteria also can activate your factor 12. Okay, and this will favor the formation of that is coagulation. You understand? Okay, and once there's coagulation, there will be DIC most likely, then tissue ischemia, adrenal insufficiency, multiple organ failure. All this will all play out in the pathogenesis of sepsis. Okay, thank you very much.